Hello. Hi, my name's Wendy Randall. I'm one of the consultant midwives at the John Radcliffe Hospital. I'm really sorry that I'm late for the session today. I was in another place and I've struggled again, as per usual, to have access to Facebook. So we thought that it may be beneficial today for me to do a session and answer any questions you may have. We anticipate that people are feeling quite anxious about the news last night and the information that Boris Johnson was sharing with us. So what we wanted to try to do is reassure you about what we're doing in Oxford with maternity services, and if there are any changes that we will make. So the changes are, we're going to try very hard to continue with the majority of what we've been doing so far, because we feel passionately that it is the right thing to do. We are very passionate about trying to ensure where possible that a single birth partner is present with women when they are attended or are attended by a midwife for labour and birth. We plead that is just one person. I'm afraid certainly in the hospital scenario, please can it just be one person who stays with you throughout. We don't recommend swapping people in and out. If you feel that you need a second additional person, could that be somebody that could join you in social media so that they're still present and supportive, but we need to do everything we can to reduce the footfall that is happening in the unit. So it is only one birth partner. That person should be identified in pregnancy as being the person who is with you for your 12-week and 20-week scan, and so it would only be that person that would then attend to be with you in labour and birth. Please do not swap them round. Labour and birth is very important, so at that point that you think that you're in labour, then please do, they can come with you and stay with you. Occasionally, if you're coming via our maternity assessment unit, we may have to, due to social distancing, depending how busy the waiting room is, we may ask your partner to wait outside until we're able to do your labour assessment. But please be mindful. We're going to do everything we can to keep you together. If you are planning a home birth, we're still anticipating providing our home birth service as we would do, and our births in our midwifery-led units. But please note, again, it is only one birth partner. We have to keep other women as safe as possible. We have to keep partners as safe as possible. So please, just one birth partner throughout. And if any of you have signs and symptoms of COVID or have been exposed, please ensure that you're following the recommendations and let us know beforehand, so that we know what's happening. So I think that's the most acute thing that I've had in terms of labour and birth, and I will go through it again, but that's certainly the questions that I have been getting most of this morning. So wanted to talk to you from the labour and birth point of view. So then if we start then with what it means when you're first pregnant, it is we still going to try where we can to enable partners. Now that's just that one specified person. So that one specified person will come with you for your 12-week scan and for your 20-week scan. Unfortunately, unless it is and obviously fetal medicine unit scans, for any other appointments in pregnancy, we would ask that it is just the pregnant woman and that there is nobody else there. Again, it's about trying to reduce the contact with different members of team. We have to keep everybody as fit and well as possible so that we can run our maximum maternity service, which is what we're aiming for. At present, we are stopping having partners being present at the 36-week scan. Again, we want to still provide the scan, and we absolutely want women to come to it, but we are not able to let your partners be present. We're doing everything that we can to get our staff vaccinated as soon as possible, and we are focusing on our ultrasound staff as well, but they are a very small team of people, and for one of them to come down with the virus and be taken out of action will significantly reduce the scans that we can offer other people, and therefore we won't be providing as safe and equitable a service for everyone. So I appreciate you all really want your partners to be present for all your appointments, for all your scans, but please, if you can bear with us, we want to provide the best and safest maternity service that we can. So in a pregnancy point of view, it's yes, at present, still to scans at 12 weeks and 20 weeks, but I'm sorry, no, at 36 weeks, no partners be present. And I'm asking you all to please bear with us. We have had people that are very angry about the changes that we've made, whose partners they try to sneak their partners into appointments, or they're coming through the doors that they should only be coming through if allowed to come through, and can be quite aggressive to staff. We are trying our best, and we really want to enable this to be the best for everyone. So please, we want to work with you, so please work with us. I see there are lots of questions coming up, and I'm hoping I'll answer some of them, but I will come back to it. So again, so your routine appointments with your community midwives in pregnancy, may that just be just the pregnant women with no partners. In terms of when you come into the maternity assessment unit, if you're coming in because you have concerns about reduced movements from your baby, if you're concerned about your blood pressure, there's concerns about your blood pressure being raised, or some bleeding, anything that's not associated with labour, we ask you to just come in on your own, and we will see you as soon as possible, and hopefully be able to get you home as soon as possible. But we only have a very small waiting room in the maternity assessment unit, and sometimes it can be very full. So to enable us to keep as many people safe as possible, and again to reduce exposure to our staff, we ask that you come in alone for that. But absolutely, if you think you're in labour and you're contracting, that is at the point that your partner would be with you. They will stay with you throughout your labour, and following the birth of the baby, they will be with you for at least a couple of hours before they will be encouraged to go home. So if you're birthing on delivery suite, if you're birthing in the spires, if you're at one of our community units, at those times we would very much will keep your partners together with you, so that they can share those really important few hours after the birth of your baby. But at the point that you are then transferred to our postnatal ward, either on level 7 or on level 5, your partner will be encouraged to go home. And if you are in a midwifery-led unit or on delivery suite, and you are fit and can go home within a few hours of the birth, then your partner would obviously stay with you at that point, and then you would all go home together. So it's about that change in environment, that change over to the next area, that we're trying to minimise exposure for you and for our staff. For women that come to our breech clinic, or women who have cervical sutures put in or removed, your partner can still be with you for those, because they are a step away from normality. and so please, they can be with you for some of our fetal medicine scans. Again, we will try to take that into consideration. We do have, we're trying not to apply one strict guideline to everyone. We do have women who are under our perinatal mental health team who have quite severe mental health issues or severe disabilities, or people who are under the age of 18 who may need some additional support, and we will work with your community midwife to find the best support for you. But for these are the general sort of rules that I'm applying throughout. When you go, after you've had your baby, if you go to our postnatal wards, we are afraid that for those who have to stay in our ward on level 6 in pregnancy, or for people who stay on level 7 or level 5 after the birth of your baby, then I'm very sorry, but we cannot have partners come and visit anymore. We have decided to stop that to offer a level of safety, and that's to enable us to still offer all the other things. So I am very sorry that we've had to stop the visiting antenatally and postnatally on the wards, and I'm also sorry that we have to stop partners attending for the first stage of induction of labour as well, because again the induction bay is in the antenatal ward, which again would be more people coming through the antenatal ward. So if women are being induced, your partner will join you when you either go to the spires or the delivery suite as part of your induction. But up to that point, we have a team of amazing caring staff who will support you and provide you with as much support as we can until your partner can be present. And of course, they can be present at the end of the phone, which is not ideal. But I hope you appreciate that that we're just trying to keep running a good and safe service. So I think that's a whistle-stop tour around what I wanted to share with you. And then if you bear with me, I'm going to have a little look on my phone and try and work out if I've answered all of your questions. Oh, lots. I clearly just talk too much. Bear with me. Right, so this is just telling me people are watching. Oh, lots of people watching today. So Maya has asked, hi, will I have my 36-week scan this month? Is my partner allowed inside the scan room? So Maya, we absolutely will be doing your 36-week scan. That is our aim. Like I said, as long as we can still keep our ultrasonographers at work. The only time it might be changed or we might be challenged is if our ultrasonographers go off sick or they have to isolate because of exposure to the virus. So yes, we still believe we want the value of the scan, but unfortunately your partner won't be able to be with you. So Ella Rose, you're saying, so is my partner allowed to still come to my scan at 20 weeks on the 19th? Yes. You know, that we feel that's all scans are important, but that being seeing your baby properly, going through all the vital parts of the baby, all its anatomy and things, we want to still try to include partners in that as much as we can. Again, the caveat is still we need to have sonographers at work to be able to fulfill our full scanning profile. So whether that's your scan is at the JR or at the Horton, we still will try to enable your partners to be present for those scans. So Ashley, you said you're so confused with COVID rules. If my partner completes 14 days of isolation after a positive test, can he still come in with me for labour and birth? Yes, if they have completed the 14 days after a positive test, they can come in to be with you for labour and birth. If they are still in their isolation period, then we ask that they don't. And whilst we really would like people to be honest about that. You know, if people think, well, I'm day 12, I'm day 13, please follow the guidelines, because we want to make sure that absolutely our staff are as safe as possible, as well as you. You keep saying that a test can remain positive for ages, but surely people go back to work. You're right. But again, that comes back to, they must follow the isolation advice that they are given, and please don't bend the rules with that, to keep us all as safe as possible. Brittany, you've asked, you have your 20-week scan at the end of the month. Yes, your partner, again, will be allowed in the scan room if we have ultrasonographers, and if they're not in an isolation period or have had any signs and symptoms of COVID. So we will be screening for that in our phone calls, as we have been doing. So Amy, you have asked, just to check, the birth partner can be with you from the start to the finish throughout the whole labour. Yes, they can. We please encourage you not to swap birth partners, and obviously for them not to go in and out a lot. So do make sure, obviously they have to leave for the toilet and things like that, but make sure that you have provisions, because again, you know, they make sure that you have enough for them to eat and drink and entertain them. And you've asked, how does it work if mother and baby need to stay in hospital with visits? Again, that's just, I'm afraid, we will look after you. We'll look after you well. We'll make sure that we give you as much support as we can. But unfortunately, there won't be any visiting on the wards anymore, except in very extreme or sort of remote circumstances. Katie, you're saying, will pregnant women be expected to shield like they did in the first lockdown? I think, Katie, the advice at present is just to make sure that you follow the government's advice, and that you have, that, you know, we're all doing the same things, that you know, you only go out for exercise, that, you know, if possible, get other people to do things like your shopping. But it really is about trying to keep you all as safe as possible, and you know, we want your partner to be able to stay with you as well. We want you to be fit and well, so it is just about reducing that exposure for you. So Yasmin, you're saying, if I am in labour but not ready for birth as such, my husband can be with me for the duration of labour and birth. So yes, while you're in labour, your partner can stay with you, Yasmin. Obviously, if you decide, when we do your labour assessment, if we think that labour is still quite early and you have more time, if it's appropriate, you will be and beneficial to you, you'll be offered the option to go home with your partner for some more time. But if either it's not appropriate and you have to stay in our ward, or you choose to stay, then your partner won't be able to stay with you. We will help support you, but they won't be able to stay with you until you either go to one of our birth environments, delivery suite, or the Spires. So Amina, you're saying, does the caesarean section increase your risk of getting COVID due to longer time in hospital, etc.? I mean, a caesarean section does increase your risk of infection, not necessarily COVID. And we do try to get you again home from hospital as quickly as possible. I think we just need the general population, Amina, to really follow social distancing and make sure they're following the government recommendations. So it won't necessarily in itself increase your exposure to COVID, because we're keeping you in a hospital environment. We're decreasing footfall through the unit. You know, our hand hygiene, our PPE is good. So that in itself won't promote it. But yeah, hope I answered that. Naomi, if your husband has had both COVID vaccine by the time of your 36-week scan, does that allow him to come along? Naomi, obviously we are looking for more guidance in terms of our 36-week scan, but what we are aware of just now is that people who have had their vaccine, who are at risk, people who are shielding, are still being told to shield. So it's not changing what we're currently seeing at present. So at present, and again, it's very difficult to tell who's had the vaccine and who hasn't. So at present, it's just a category of no for partners being present at the 36-week scan. Chloe, I hope you can see that yes, partners at present can still attend the 20-week scan. Lee, you're asking, can partners be tested along with women when they're in labour? Again, it's something that we talk about from time to time, and there was some guidance saying, would that be possible? You know, when you test partners, you know, we don't get the results generally to sort of the following day anyway, and because partners aren't staying in the hospital, it's of less relevance to us at this time. So it's not something that we're doing at present, but watch this space. This pandemic seems, you know, things change all the time. Sophie says, are partners allowed at scans for those under the Rainbow Clinic? Again, like I said, Sophie, there are some exceptions to what we can allow partners to attend. And as far as I'm aware, that pathway hasn't changed. But again, Sophie, is watch this space moving forwards. And for people to not get frustrated, some people are coming in for scans and may have partners with them, and for other people they think, you know, why has that person got their partner with them and I haven't got my partner with them? People are having partners there for very different reasons. So, you know, we are trying to make sure that we keep it as safe as possible for all, but please don't think that we're treating people differently. There are just some people who are a bit more at risk than other people, and we have to be able to support them some more. I think OMVP have answered some questions. So Scott, you've said, what's the difference between 12, 20 and 36 week scans, and why allow partners to 2/3 of the scan? So again, Scott, at different points, so at those different points of pregnancy, you're seeing different things. If our ultrasonographers do 100 scans a day, that's potentially 100 different people that we are seeing in that day. And what we did before was we didn't let any partners come to any scans, not 12, not 20 and not 36, because that was our way of keeping our staff completely safe from increased exposure to other people, because they're being exposed to 100 people, say, every day. What we want to do is try to enable you to be there for the most important aspects of the pregnancy, for you not to be deprived that experience. So we worked long and hard. It took us some months to enable partners to be present for scans, and lots of risk assessments in terms of our scan rooms, our clinic areas, all of those things. And we feel at the 12-week scan, that tends to be the first time you've ever seen your baby. And so we felt that from that support of that couple, that was a crucial scan for a couple to be part of. Then you have your 20-week scan, which is ultimately our scan that enables us to see every bit of your baby's body, and what we're assessing is for any abnormalities, etc. So we're really looking in detail at that scan. And again, we heard from women that they felt that that was a really important scan for their partners to be part of. When you get to the 36-week scan, the 36-week scan is basically, you know, it's, for us, it's looking at placental function. There's it's part of our growth scan pathway, but there's I suppose there's much less to be gained from being part of that appointment as there was before, and for our staff that reduces 1/3 of their exposure to other people. And like I said, what we don't want to do ideally, we don't want to go back to having nobody present at scans, because we think it's really important for you to be present at some of them. But we also need to look after our scan staff to make sure that they can still come to work, so that we're not having to stop scans. Because at one point at the start of the pandemic in March, we stopped the 36-week scans to reduce the exposure to our staff. So the scan staff are anxious about the exposure to the virus. They're anxious that this virus is more infective, and they're anxious about all the different people they meet every day. So I mean, we absolutely have done it to try and maintain the best and fullest maternity service that we can, whilst hopefully not depriving partners of too much, and keeping our scan staff as safe as possible. So I appreciate you're disappointed, and it feels like we're shutting you out, but we are doing it for the safest and best reasons. Bex, you've asked how long can your husband stay after your caesarean section. Bex, it's generally around 1 to 2 hours after the caesarean section. It depends how quickly we get you moved upstairs, but I suppose the shortest is probably 2 hours, but it can be a little bit longer. It just depends on the availability of beds on our postnatal ward, and obviously it depends if you end up in our observation area as well. Sometimes that time is a little bit shorter, and again that's about exposure to other people, because that is a 4-bedded bay, and more throughput of women as well, so more exposure. So we're trying to make this as best as possible for everyone, but reducing our risk as much as possible. Lots of people watching. Leah, you said. So Leah, you said, hi again. Could there be a chance at any point you stop the dad partner being allowed to be there at the birth? Leah, we are trying, absolutely. That would be the very, very last thing we would do. We really feel it is important to keep partners there at those crucial points. The only time that we wouldn't want them to be there, to be present, is if they are isolating because of exposure to COVID or signs and symptoms of COVID, because we have to keep our staff as safe as possible. So we really feel it's important to try and keep partners there. And I have to say, our midwives, our doctors, our support workers, they're all absolutely amazing and worked so hard through this pandemic to try to make this the best service that we could and keep people together. And I think generally we're not going to get it right for everyone. We do try our best, but as long as people, we just can't reiterate more about what Boris was saying last night. Please follow the guidelines. Please respect social distancing. Please don't, if you are meant to be isolating, please isolate. Don't think, oh, well, I feel all right, I'll be fine. This is highly infective. Please protect us by making sure that you follow the advice given. Katie, you're saying, is this the same for caesarean sections? Will partners be allowed to be with us? Yes, Katie, partners are present for caesarean sections unless you have a general anaesthetic. Some women choose to have a general anaesthetic, some women have to have a general anaesthetic, and partners can't be with you for that, but they can wait for you to come out of theatre. But yes, we try to keep partners with you and try to keep it that birth experience. So Maya said, since partner is not allowed on 36-week scan, is it all right to take a short video of the scan so that my partner can see the baby moving? Maya, we don't, the Royal College of, or the Association of Ultrasonographers does not recommend taking videos of the scan. They can be a distraction to the ultrasonographers, and it is a screening tool. I think the most important thing really for your partner is feeling baby's movements, and at 36 weeks that movement of baby's feeling is so much better in lots of ways than seeing it, and much easier to see, I suppose, in lots of ways as well. So I'm really sorry that you can't use your phones to take pictures or videos during the scan. We want it to be as quick a process as possible, but as thorough a process as possible, and not disrupt what's happening. So I am sorry about that. Laura, you've said at the 36-week scan, can your partner still come with you and stay in the waiting room? Laura, I'm sorry, no, your partner won't be able to come into the building with you. They can wait outside in the car, or under shelter if the weather's poor, but I'm afraid they can't come in with you. Thank you for your thanks, everyone. Obviously, Rachel, I've addressed the bit about the 36-week scan, and I'm sorry there won't be any filming during the scan. Cara, you've asked, are partners allowed in for inductions? So Cara, they're allowed in when you go to either the Spires or delivery suite as part of your induction, but unfortunately they can't come. They were coming the day before when women had their Foley's catheters put in, but we've had to stop that because that's done on level 6. So you will come in for your induction to level 6, and it's only when you go to either delivery suite or the Spires that your partner will join you there. Vanessa, you're saying if you have to go for growth scans, can your husband attend the 28 and 32 week scans with you? Vanessa, I don't think so. I think it literally is only the 12 and 20 week scan, because the majority of growth scans, again, are scans where the baby is growing well. If there is anything that we have any concerns about and it becomes more of a fetal medicine issue, then we will involve them. But I'm afraid for anything other than 12 or 20 week scans, then partners can't come with you. Laura, you said this would be the very least they could do, really. I don't understand why they are allowed in the other scans and not on this one. Laura, perhaps you haven't seen the beginning of the film about my explanation about the decreased risk of exposure. This is about our staff, it is about exposure to other people as well, and our waiting rooms, and to be enable social distancing. It really is very important that we try to keep our scan department running at its full capacity. We wouldn't want to have to reduce any of the scanning that we're doing because of risk of infection or exposure to other people. So I'm sorry that you are clearly disappointed about this, but it is something that we can't do. Georgia, you've asked, will women be tested onwards after birth, thinking about risk of transmission of virus and people being asymptomatic if told to go up there? So Georgia, women are tested when they're in labour. So we know that, and we get the results. If we have a woman, so on occasion it has happened that a woman has been in a 4-bedded bay with somebody, and after the birth, when the result comes back, that woman is found to be asymptomatic and positive. We have then isolated the people who have been exposed, and we have retested them and screened them. So, again, we're trying to get the test results back as quickly as possible. It's why we do the tests at the beginning of labour, in the hope that we may have the results much quicker by the time the baby's born. But like anything, it can happen anywhere in life. It can still happen in maternity. But we will, if you have been exposed, we will, or the potential to have been exposed because you've been in a room with somebody who's been positive, we will isolate you, we will provide that support and the screening associated with it. Bex says, do you know if I need a COVID test before my caesarean section and when that will be done? So Bex, you will be invited to attend the hospital to meet one of the caesarean section midwives who will take you through the details a few days before the caesarean section. And yes, you will have the COVID test beforehand, and if the COVID test comes back positive, your caesarean section will be postponed. Unless it critically has to be done, in which case it will be done in our emergency pathway. But otherwise, we ask you to have the test result and then to isolate until you come in, yourself and your partner. They won't be tested, but they will be encouraged to isolate with you in the 3 days before your caesarean section. So Rosanna, you've asked, for women who are transferred to the postnatal ward, can partners bring clean clothing extras into the hospital and arrange time? What has happened before is partners have arrived with extra clothing, etc., that's required, and one of our members of staff will either go down and meet them and collect it and take it upstairs, or if you're up to it, you can go down and meet them and collect it and take it upstairs. But I'm afraid your partner won't be able to come into the maternity unit. Danielle said you'll be tested 48 hours prior. That's what the anaesthetist told me. So yeah, some point in 2 to 3 days before for the caesarean section. Oh, thank you, Emma, for explaining about the scans. Louise, you're asking how long do you anticipate these measures to be in place? That has made me sigh, because I wish I knew. I think we all wish we knew. We're desperate to get back to normal. We're just following guidance, from the government, from our royal colleges. We know that we're different in maternity. We know that visiting in the other side has in the general trust has completely changed. We hope that we're not asked to put other measures in place, and we hope that this is the most severe that we have to do. But we will do what we're advised to do, because we need to keep this the safest service for you. It's so important for us to try to still provide the maximum amount of care with in as safe an environment as possible. So we promise I have a weekly phone call with the chair for the Oxfordshire Maternity Voices Partnership, and equally we text in between in terms of updates and things that we have to post. And while we had decreased some of our Facebook lives, we may have to do some more, because what we want to do is try to reassure you as much as possible and answer your questions. So we'll continue to keep you up to date as much as possible as things evolve. But at present, this is where we stand with our measures. Vicky, you've asked, does all of this apply to the Horton? Yes, it does. We are all one maternity service. Scott, you said, as a first-time dad to be, I feel so sad that I've missed so much of what I'd call a duty of care to both patients. I appreciate it's hard, but I don't get why people can go to 12 or 20 week, but I can't go to our 36-week scan. Again, I am really sorry, but that is a third less people every day that our ultrasonographers meet. And it's not, if you think about the amount of time that evolves between 12 weeks and 20 weeks and 36 weeks, it could be a different ultrasonographer, it's different risk every time. We are very sad that it's had such an impact on you, Scott. This pandemic has had a horrible impact on everybody, and we really don't want to go back to where we were before in March. We want to, be trying to move forwards and work within the confines of this virus. So I am really sorry, and I hope that we can still continue to offer the 12 and 20 week scan participation for partners. We're going to keep trying as much as we can to promote as much normality for you guys as possible. Rosanna, you've asked, can birth partners be present at all stages of birth? yes, Rosanna, as I said before, they're with you from when you first, when the midwife feels that you're in labour, when you have that assessment, until after the birth, and that fourth stage of labour, which is that lovely time of bonding and establishing of feeding after the birth. Unless, obviously, I have to put the caveat in there, they are COVID positive or are self-isolating because of contact or symptoms. So Natasha, you said that makes so much more sense now for labour. Was really worried before that coming to hospital in labour and pain and expected to go into the hospital and upstairs on my own. I appreciate it's very difficult, but so much has been missed mental health wise for mums and partners. Okay. Fru, you've asked, do women have to wear masks during induction of labour birth? Fru, we ask you if you're moving between the wards, ideally if you can use masks, and if afterwards on the ward, if you're going, if you're leaving your bedside and going to the bathrooms, etc., anywhere you might have contact with people or staff, to wear your masks. But actually when you are in labour experiencing the pain of contractions, etc., then you don't have to wear a mask. So Natasha, I think I've mentioned the 32-week scan. No, its partners will only be present for the 12 and 20-week scan. Tammy, I've just answered that question about wearing masks when you come in to give birth. So you wear your mask into the unit, but if you're contracting and you're in labour, then no, and absolutely water births are still going ahead. So Henrietta, you've asked what happens if you need to stay in after the birth and your partner needs to bring extra things if you stay longer than expected. So just as I was saying before, your partner can come up to the ward. If you can come up to the hospital, they can't come in to the unit, but if you are fit and well, you can come down to meet them at the door and take the stuff from them. Or if you don't feel able to, one of members of our team will be able to do that for you. Bridie, you said your last induction went from 4 centimetres to baby born in 20 minutes. You're worried that your husband could miss it if this happens this time round. So I think, Bridie, the most important thing is there's so many different parts of the induction process. If you come in and have the catheter put in and you're going home, then you would, you know, your partner will be with you. You'll only be away from them for an hour. And if you go into labour from that, then your partner will come in with you. If we're getting to the point for your labour that we break your waters, it is at that point that your partner will be with you anyway. So, you know, please don't worry about that. And Bridie, if you want more information on that, on the Maternity Voices Facebook page, they do have a film on induction of labour. So Emily, you've said, what's the information on pregnant women in their third trimester working in a public facing role, for example, a supermarket? Again, Bridie, you have to speak to your employer about that. From our perspective, midwives from and doctors, support workers from 28 weeks have non-patient facing contact, but I'm sure your employer will have risk assessed that, so please do talk to them as soon as possible. I can only tell you from a maternity perspective, our employees are non-patient facing from 28 weeks. Bex, you're saying, when you come in for your cesarean, can your husband come into hospital with you? Yes, Bex, we have, because when you have a planned cesarean section, you're on what we call our green pathway. It's our as reduced COVID as possible pathway, because you've been screened and you've been isolating and you come into a designated place, then your partner comes with you when you come into hospital. Jade, you said, if you have to stay in hospital a while and can't have any visitors, how can we get clean clothes, etc. Jade, I think I've answered that as part of this if you want to watch it back, but as a quick repetition, your partner can bring up to the door of the maternity unit. They can't come in through the maternity unit, but if you're well, you can go down and meet them and pick up the things that you need, or if you're not feeling up to being able to go downstairs to meet him, one of our members of our team can do that for you, but they won't be able to come up to the ward to drop anything off. Catherine, any changes to caesarean sections in terms of partners present and planned caesarean and planned sections going ahead? So we're continuing to run our caesarean sections. The only difference would be if you have tested positive for COVID or your partners are isolating, then we have to review how urgent the caesarean section is in terms of which pathway we put you on. So Daniel, you said, sorry, just joined, just got back from 36-week scan, all is looking good. I caught the end around the date of the birth bit. At what point I'm allowed in? Daniel, can I, rather than go through this again, because I'm very aware of time and I just have 5 minutes left, can I encourage you, the Maternity Voices do save this, they'll save this film so that you can watch it back, and I will have answered that question. Laura, you said your native language is not English. You have difficulty understanding all the explanations at the scan and you would really struggle to understand without your partner. Could there be an exception in the case for the 36-week scan? Laura, when English is not people's first language, we don't encourage using partners for translation. We feel it's much more important to use something called Language Line. So when you come for your appointments, we should be using Language Line rather than depending on your partner. So please don't worry, we will use Language Line to help support you to make sure that you have the full information. Emma, you said, is the trust still supporting home birth and BBAs in community? Emma, we absolutely hope that you don't have a BBA. It's very important when women are in labour that they have a trained birth attendant with them, like a midwife. We absolutely support home birth. You know, again, it's about us having well staffed to be able to work. We were so lucky that our staff have stayed in good health, and actually we've seen an increase in home birth and births in our standalone midwifery led units during the pandemic, and that's been amazing. Again, we've just got to keep our community midwives safe and well, and obviously not having to stay at home self-isolating, so that we can still provide full service. But where other maternity services in other regions actually closed their midwifery led units and their home birth service, we've always kept them open, and we passionately believe in trying to do that again this time around. So Phoebe, you said you had your baby in July and had to then do the induction on your own, but the midwives and everything are so lovely and will definitely make you feel safe and cared for. It was hard, don't get me wrong, but it's so worth it at the end. Phoebe, thank you so much. That's really great and positive feedback, and I hope that will reassure people, because it was after that point, I think it was August, when we started introducing partners being there for induction. So thank you, Phoebe, for your positivity. So Katrina, you've got some advice for the woman who asked about isolating in pregnancy from work. Lizzie, you've said, is home birth still an option? Absolutely, we've just talked about that. Will your partner be allowed to join me if I have to transfer to hospital, either mid-labour or post-labour? Yes, they will, Lizzie. Harriet, you've asked, are partners only allowed in when you're in established labour or the whole labour? Harriet, it's at the point that you come in for your labour assessment, or you know, if you're attending the JR or you're attending the Horton or Wallingford Wantage, when you think that you're in labour, your partner comes with you, so that we try to keep you together to support you. Katie, you're saying that your 36-week scan isn't just a growth scan. It will decide if you need a caesarean section or not due to your placenta. Will you be allowed to term with me due to that reason. Katie, again, I'm afraid not. You know, it's really, I presume, looking at placental localization, and you will have the option to discuss the plan from there, and the plans for the caesarean section, that your partner can be part of that telephone call afterwards. But I'm afraid it isn't a reason for him to be pregnant at the 36-week scan. Amy, you've said, sorry, slightly confused at visiting. There's no visiting the wards at all if you or the baby are admitted into hospital. That's right, Amy. We've had to stop visiting on the wards. Again, there is a very, very small proportion of people that have particular needs, and for those women we make a plan with them, but as a general consensus, then there's no visiting on the ward. Emily, you're saying, are there any plans to get rapid testing for partners so that they can stay before and after birth or attend scans? Emily, not at present. Tammy, you've asked, do we need a COVID test when we come in to give birth? We strongly recommend that you have a COVID test. Tammy, we appreciate that they're not very nice things to have, but it enables us to have a fuller picture. You know, again, it comes back to being able to advise people afterwards whether they need to isolate or not, and contain the virus. Jessica, I'm sorry that you can't hear and that you're having problems. Hopefully, when they've saved the film and made it available on their YouTube site, you'll be able to access it later and hear what's going on. Brittany, yes, water births are still going ahead. And Nikki, you've said your daughter is planning a home birth at your home. Will I allowed to be there as it's my home? Nikki, if it's your home, if you're planning to be your daughter's birth partner, then obviously you can be present for the birth. We ask if your daughter's partner is planning to be present at all, then we ask for only one of you to be present to support your daughter, whether that's you or your daughter's partner, and obviously it's your house. If you're not the planned birth partner, you'd be in another part of the house, but it's about our staff only being exposed to one additional birth partner at a time. I think I've answered that question. Danielle, you said you got a call this morning to say that only you could attend your 36-week scan tomorrow. Yes, that is correct. Karina, so you said, so if you're in for days after the labour due to complications, you can't have visitors, your partner, to come in daily to visit until you're well enough to leave. That's correct. We are sorry, but that is correct. Catherine, you're saying, do the same rules apply to the midwifery-led units? Yes, they do. Lucy, you said, can you dial partners into scans via phone or video call? Lucy, I'm afraid that the Royal College of Radiographers, etc., have said no to phone calls or videos during scan, because they have potential to disturb the scanning process, interrupt it and prolong it. So I'm afraid that is a no. Rosie, if mum and baby are well after caesarean section, how long will they stay in hospital? Rosie, if you have a caesarean section one day, we are hoping that you can go home in the evening the following day, if you'd obviously had your caesarean in the morning. But if it's in the afternoon, you may have to stay in a couple of nights before you go home. Georgia, I think I've answered the question about if you're transferred from a home birth or a freestanding midwifery-led unit with complications, then your partner can meet you at the unit and be with you. Yes. So Katrina, you're saying you believe the advice is that a single birth partner is allowed throughout labour and can stay until you're discharged home, usually a few hours. If for whatever reason you're transferred to the GR, then partners cannot visit. So if you're transferred in from if you're planning home birth or birth in a freestanding unit and you're transferred in labour, then your partner will come in with you. If you are in a birth environment and you go to the postnatal ward at the point that you're transferred to the postnatal ward, then that's when they go home. Becky, you're saying how common is it to have to stay in after delivery? You know, everybody is individual, Becky. If this is your first baby, quite often people want to stay in for overnight to have help with feeding the baby. Other people have lots of help and support at home and would rather go home. We just need you and the baby to be well after the birth, for you to have passed urine, for your blood loss to be normal. We have no concerns about you or the baby. But the majority of people will be well after they've given birth to the baby. So there's a question, are these new rules and changes regarding partners a national guideline, or is it down to the OUH Trust? There was a paper produced a month or so ago from the Royal College Midwives and Obstetricians and Gynecologists, asking for us to look at opening up options, and we did start a plan to enable that to happen. But following on from the move to Tier 4, we were under pressure to have a look at the options, and then basically individual maternity units have been asked what rules, to work out what keeps their staff and their service as safe as possible. So this is specific to us in terms of how we keep the service as safe as possible, because we don't want to have outbreaks, and we have already experienced a reduction in staff associated to positive COVID results, and also people having to isolate because of contact. We need to be able to run a safe maternity service, and we feel this is the way forwards. I'm glad, Sam, you feel well looked after. Roz, you're asking what will the rules be regarding scans on the fetal medicine unit. Again, it will depend. What we're trying to do is to enable people to still be present for scans in the fetal medicine unit, but the staff will be in touch regarding that. Again, this may be something that changes, but at present it's not. But it will be a watch this space. Fru, I think I've answered your question on wearing masks. So Claire, you said if partners have COVID symptoms and can't come in, are we allowed to video stream throughout labour? Yes, you can. Some people are choosing to have an extra, their mother or their sister or their doula on a video stream throughout labour, and that is possible. Emily, you're saying what's the guidance if your waters break before contractions begin? So Emily, if you're coming in for that assessment and you're not contracting, we would ask you to come in on your own, and then we will advise from there afterwards. Obviously, if your waters break and you're contracting, your partner will come with you. Emily, you're asking what are the current guidelines for mothers and partners visiting babies in the neonatal unit. To my knowledge, the neonatal unit haven't changed their guidelines yet, but they may be that may be in process. So I think the key would be to find out what's currently happening from them, but I'm not sure what that is at present. But I can ask, and I will try and get that information to Louise, who's the chair, so that she can share that information with you. Tilly, you've booked for an induction on Monday. You understand that your partner won't be allowed in when you get the balloon inserted, but will be allowed in from when you return the next day when your waters are broken. Yeah. So, and again, Tilly, it's just to be aware that sometimes there's a little bit of delay. So when you first arrive the following day, your waters aren't necessarily broken immediately. So it's at that time that we progress with you in labour that your partner will join you. You may have to come in on your own to begin with, but we don't want you to be in labour without them being present. I think I'm getting to the end of these. I think people are obviously trying to help me with the with some of the discussion about scan. I am really sorry that it's causing upset. You know, that is not what we're here for. We want to create as positive an experience for you as possible. I think I'm going to have to end there anyway, because I think I've been on for about an hour, and I think we've covered everything that's here. And I would just advise you, I'm scanning quickly through these, and I think I've answered all of these questions as part of it. So I would encourage you to have a look at this film afterwards, and hopefully that will help to answer your questions. So I'm terribly sorry if I haven't answered your question. You feel I haven't answered your question, please watch this film back. And if I still haven't answered, if you post via the Maternity Voices Facebook page, then I think we will. I will answer your questions for you. So I'm very, very sorry, and I hope that this. We wish you all well, and we want to keep you as safe as possible. So please, everybody, take care, and please let's all do our social distancing and get to the end of this adventure, and start with some new fun stuff. Thank you very much.